would have played. Okay, so hi again, this is Dr. Shaan from Vitality Chiropractic. Welcome back to our interview series. I'll be going through things with other healthcare professionals, seeing more about their stories, how they got started, and of course the people that they help. So today's guest is Dr. Thum. He's from TCM Housecall. Dr. Thum is a traditional Chinese medicine doctor with years of experience helping patients with aches and pains. He performs house calls, which is quite different to a lot of his colleagues, and he's able to help those who are unable to leave the house, even bring his kit along with him. So, Dr. Thum, how are you doing? How are things going?
Yeah, I'm good.
What I wanted to do first, just for people who maybe haven't been to a TCM before, haven't seen a TCM before, how would you describe TCM to people?
TCM is a traditional therapy that helps to rebalance your body condition, to boost your immunity, strengthen the body defense system, to fight off the virus or germs by way of herbal medicine, acupuncture, tuina, cupping, and scrapping.
Okay. And would you say there's any particular system that you're working with within the body?
Well, the whole TCM theory is based on the Meridian and as well as the Zhangfu. So it works on rebalancing of all the points and all the organs together.
Okay, can you tell us a bit more about the Meridian?
Meridian is basically is a channel that in TCM theory, which energy that flow throughout the whole body. Okay, so in TCM, based on the TCM theory, whenever you feel pain, it's a blockage of the channel. It means a blockage at the meridian point. So normally, how we treat such a condition is by doing acupuncture or cupping or tuina a certain point, which help to unblock it.
Okay. And can you mentioned another system there? Is it Changfu? Sorry about my pronunciation. Could you explain more about that as well?
Okay. Based on the TCM theory, we have in anatomy we have different organs. Okay, that's the physical parts. Okay, but in TCM theory, we do one level of abstraction. We split the body into different subsystems. Although the name, some of it follow the organ's name, but actually more than that. For example, we have liver, heart, the spleen, P, lung, Fei, and kidney, Shen. Even though the name is mapped to the organ, it doesn't mean it's only restricted to the organ. It actually is a subsystem. It's the name of a subsystem. For example, kidney. Okay, kidney probably based on anatomy or today modern medicine is only related to probably urine and things like that. But in TCM, it's related to reproduction. It's related to the bone, okay, the growing of the bone, and it somehow is linked to the ear. So certain function of the ear is related to the kidney. So it's a different approach compared to the modern medicine. Okay, so it breaks up the body into different subsystems, and given the name, there's a Zhangfu theory. So like for example, kidney. The kidney itself represent more than just kidney organ. Okay, including all the whatever subsystem, for example, it could be related to some hormones as well, okay, and so on. So it's a different view compared to the modern medicine, which is purely physical.
Okay. And so let me ask you, if we go back to the beginning, how did you decide that you wanted to train as a TCM?
Okay, I was software architect. So from software perspective, TCM is a very interesting application based on the generic framework of yin yang and 5 elements. Okay. Those are abstract frameworks. So which in turn, based on the philosophy of I Ching, the book of change. So to know more and understand it better, I spend time to learn and get attracted to it. So, and then I find that it's very helpful and it can help people to solve some of the problem that cannot be fixed by modern medicine. So yeah, that's how I get started.
Okay. And how long were you training for at the time?
We have to study for 7 years.
Wow.
Okay, 7 years part-time in Singapore, including some training program in China, Guangzhou University of TCM.
Okay. Wow, that's a long time of training.
Yes.
So let me ask you, why did you decide to get into house calls? I know it's a big part of the company you're working with. It's not 100% house calls, but why did you really decide that this is where you want to move more towards?
When I'm practicing, I realized that there are many patients who might need treatment, but not able or not convenient to move around to go to the clinic. Okay, so given the aging population, we are seeing this more and more. So I'm just thinking, is there a way to help them? And there is a market for it, and so that's how I get started.
Okay. Okay. And what would you say are some of the biggest challenges that you found in your profession or for yourself personally?
I think one of the biggest challenge when we are doing house call is time management, because we have to travel from one point to another. Even though Singapore is not that big, but still, with good infrastructure and transport, but still, it takes time. So that's one of the I think biggest challenge to maneuver, because every different time constraints. So moving from one point to another, you might not be able to make it in a sequential order. That's one of the biggest challenge. The second thing is, I think my background is in engineering. So I think it's not so easy for today's professionals who undergo the normal, scientific training to understand what TCM is. However, I think from software perspective, I think software developer might be easier to understand when it comes to abstract framework, but not to the general public.
Okay. Okay.
So there is a big challenge to explain the concept. Like, for example, just want to ask me about, what is Meridian and what is a Zhangfu, all this. Yeah, there is a challenge to explain such concept to the general public.
So for the patients that you are seeing, say that these members of the general public, what kind of conditions or problems are they usually presenting with? And is it always with a problem, or sometimes people are just there for improvements in health?
Okay. For house call,
two parts to that question.
Okay. All right. I think in general, when they come to TCM, one is they want to manage their health, because then sometimes they find that they are not in a perfect condition, but when they go and do blood tests or go and do some scanning, everything is right, but they just feel it's not so right, so they want to figure out what's wrong. So this is one type of patient. There's another type which generally they are having some issue, like for example pain, but cannot be fixed by the modern medicine. Then they come to us to look for alternative. When you come to house call, generally the patient are those who are bedridden, not convenient to move around, like stroke patient, or some that suffer from a sports injury. Yeah.
Okay. And are there any other particular conditions you've seen before, or maybe the ones that you feel really react best to TCM?
Okay. So far, I think to get immediate effect, normally it's a pain relief that is most effective. I think acupuncture is a proven method and therapies used worldwide. So there is something that immediately patient can feel the relief. Medicine, it depends on the type of disease. Like for example, if it's a chronic disease, then probably it will take some time.
Okay. And I understand generally you have quite a busy schedule. What do you think are some of the most important factors for your success?
To me, I think the most important thing is the efficacy of the treatment. We do encounter cases where the result is not as good as what we want, but we need to continue to do research and to find a better way to solve the problem, so that when we encounter the same condition again, we can help to fix it better. It's a never-ending journey. It's a lifelong journey. Yeah.
And so what would you say are some goals you have? We'll say, again, I'll kind of pre-frame this as a two-part question. Some goals you have, say, for yourself and your own practice, and then for the profession overall.
Okay. For the practice, I think for me, I hope we can help more patients who are in need. As a goal for a profession, one of the things that I would like, because based on my background in engineering as well as TCM, I hope that I can help to modernize TCM so that more patients can benefit from this traditional therapy.
Okay, and what ways do you think would be a potential for modernizing TCM? How do you think that could happen?
For example, when you come to TCM, one of the issue is always about standardization. Okay, so what are the things that we can standardize? For example, let's say when we check the tongue, what is the condition of the tongue? So different physicians sometimes might have slight difference in terms of the judgment. So can we use modern technology, okay, that can help at least to a certain extent standardize this diagnosis? Then the other part is I think TCM is based on a very different philosophy compared to the modern medicine. So we might probably need a very different framework in terms of evaluating it, as well as to provide a framework that can the general public can understand better.
Okay. And of course, in an ideal world, and not just here in Singapore, but maybe even in other countries, what are some changes that you would love to see in the healthcare systems?
One of the things that I would like to see is there will be more cooperation among the mainstream healthcare professional as well with the alternative, for example, with a TCM or chiropractor or physiotherapists, to explore more ways to help the patient in terms of the efficacy of the treatment as well as the cost to managing the cost.
Okay. And given the current lockdown or the semi-lockdown of the circuit breaker we're experiencing here in Singapore, what are some tips that you would give for people who are now spending more time at home and, of course, potentially working from home, sitting forward? What are some of the tips you would give for them to have better health at home?
I think the first thing is can do indoor exercise together with the family members since everyone at home. For example, like simple yoga or tai chi, or there are some stretching exercise which they all can do together. And another important thing is from TCM perspective, they can try a food therapy to strengthen their immunity system during this lockdown period. As we know, prevention is always better than cure.
Okay, and before we go today, I just want to get maybe a little bit more personal. What is some advice you would give yourself 5 years ago if you had the opportunity?
I think maybe I should have joined BNI long time ago and started the house call services earlier.
Okay. Well, Dr. Thum, I want to thank you for joining us today. And I just want to thank everyone who's watching live or watching this on the replay as well. If you have any questions, of course, you can contact us either via Facebook, you can give us a call or a text at 84389550, or email help@vitalitychiropracticcentres.com. I'll also put Dr. Thum's information into the description and into the comments, so if anyone wants to contact him or wants to ask more questions, of course you can. Dr. Thum, I want to thank you again for joining me today, and everyone at home, stay safe and stay healthy as much as you can.
Okay, thank you, Dr. Shaan, for organizing this, and thanks everyone for watching. Thank you.
Thank you.